Okay, so it's 5 past the hour, so let's get started. So good morning, good afternoon to everyone. Thank you so much for joining this session. It's a joint session organised by INEE, the Interagency Network for Education in Emergencies, and the Alliance for Child Protection and Humanitarian Action. And it's part of a joint project that INEE and the Alliance are doing to support both sectors to work more closely together to encourage joint and integrated programming. The main focus of this webinar is to introduce a new web-based resource and walk you through how it's structured and how you can use it, and then give you a bit of time to play around with it. But I'm also very pleased to say that we have a couple of guest speakers who are going to be illustrating some very real joint integrated programming in their contexts. So we have Yid from IRC Ethiopia and Jagath from Jagath's also
Sri
joined us
Lanka.
with his programs as well.
Mhm.
I'd also like to introduce you to Rachel. Rachel and I are working together on this consultancy, and Rachel will be talking you through the program development a little later. My name is Mark Chappell. I am the Senior Technical Focal Point working across INE and the Alliance on this initiative. So just running quickly through the agenda for today, we'll do a little bit of introductions. We'll give you an overview of the initiative. We'll talk you through the work done to date and where we intend to be going with this. Then we'll have a chance to look at a snapshot of some real-life integration from Ethiopia and from Sri Lanka. And then we'll be walking you through the new web portal. There'll be a chance then for you to ask us questions, any issues you might have, anything you want to discuss. The webinar today will be conducted in English. I'm very pleased to say we have the language facilitators from INEE, Emmeline, Maria, Eamon, and Laura on the call. And we're hoping to replicate this in all INEE languages, Arabic, French, Spanish, and Portuguese in due course as we develop the resources to go with them. So watch this space for follow-up orientation sessions. I know that some of you have already been doing this. In the chat, if you could write the name, the ministry, organization, or institution you're from, and your role, so we can keep track on who's on the call. Fantastic. We've got about 90 participants. Really good to see. And I know, yeah, some of you have already been doing this. So I'm going to start giving us a bit of an overview of the initiative, then I'll hand over to our guest speakers and then to Rachel, and then we can come back for a bit of a Q&A. So we might not use the full time, but throughout the webinar, there is a Q&A function in Zoom at the bottom, as well as a chat function. And my colleagues are very kindly monitoring those. So please add any questions to the chat or to the Q&A, and we can address them either during the webinar or we'll follow up afterwards with any responses and resources you might need. So the whole point of integrated and joint programming is to try and support child protection and education programs to work more closely together. And we know in the modern humanitarian system, we have what we call silos, usually under the cluster system. So we have an education sector and a child protection sector. And for various reasons, it's been quite challenging, despite both sectors working with children and many organizations instinctively working for child well-being and putting children at the center. It has been challenging to formally set up and run joint integrated programming. So about 5 years ago, INE and the Alliance decided to come together to set up this initiative to better support joint and integrated programming at field level. And it's run in parallel with a project run by the Global Education Cluster and the Child Protection Area of Responsibility that was looking at collaboration and coordination as well. So the two projects work very closely together. And we're in a new phase of this project now, where we're trying to move forward the conversation and encourage better field practice around joint integrated programming. So before we start, I wanted to give a bit of a reminder of the benefits of integration, why we should be doing this, why we should be looking at it, why we should be putting children at the centre of our programming. And we know from the work that's been done and from research that's been done, when you integrate education and child protection, it can improve child well-being. When you integrate PSS or SEL or other child protection elements into education programming, we can see an improvement in learning outcomes, but definitely an improvement in learner satisfaction and child happiness with being in the school. When we do integrated programming, it supports and encourages a child-centered approach to humanitarian response. So it can prevent children and young people slipping through gaps between services, and it can maximize the impact of multiple sector interventions. By putting an education lens on your child protection programming, you can support children and young people to access education and reduce dropout, and also better identify children who might be at risk of dropping out. If we focus on improving well-being in family and community ecologies, this can also have a positive impact on learning outcomes. We know that integrated programming can be cost-effective and prevent duplication. And we know that integration also aligns with the current efforts underway to transform humanitarian delivery, including the humanitarian reset, UN 80, and moves to bridge the humanitarian development nexus or triple nexus, and also the localization agenda. We know many local organizations instinctively work in a more unified way and aren't so rigidly stuck with the defined silos. So what grounds our work in INEE and the Alliance are the INEE minimum standards for education emergencies and the child protection minimum standards. And a piece of work we did 5 years ago showed there was a huge overlap between these, covering everything from safe learning environments, positive discipline, psychosocial well-being, protection of education from attack, through to children's participation, community engagement, and support to parents and caregivers. So there's a huge amount of work which covers the intersection between the two sectors, but it's also important to note that there's some specialisms which remain within the sector. So we're not calling for the two sectors to be integrated once and for all, and for everyone who does education do all child protection, and all child protection actors should be able to do all education. No, we recognise that there are education specialisms around, say, curriculum design development, and there are also child protection specialisms around case management, etc. And these remain firmly with their technical areas of expertise. But there's a huge area of overlap, and that's what we're here to talk about and to support. So as I said, 5 years ago, INEE and the Alliance came together, and we pulled together a multi-agency advisory group. And through this, we developed a position paper setting out the rationale for joint and integrated programming. We did a piece of research on the impact of COVID-19, which looked at the impact of school closure, both on educational and protection outcomes. So a really useful piece of work that shows how education is protective, and when it's removed, we see an increase in protection risks. We developed the guidance note, which is really focused on implementation at field level to support integrated child protection and education programming. And this guidance note has formed the basis for the web resource we're going to introduce to you later. And we reaffirmed the commitment to this, both across INEE and the Alliance, with the joint pledge at the Global Refugee Forum. We have also contributed to advocacy papers, technical papers, webinars, and online sessions, including one like today. Also wanted to flag the work we've done on making the case, our advocacy work, because this has been important in making sure people like major donors like ECHO and Education Cannot Wait include child protection elements in their education calls for proposals. So we did a lot of advocacy around COVID. We've been present at international pledging conferences. We've released blogs, statements, briefings, and pretty soon we'll be releasing a new FAQ for joint and integrated programming, just a 2-pager, which will help you with your internal and external advocacy. and working very closely with the Alliance on an evidence synthesis about what works for joint and integrated programming and why we should be doing it. Also giving everyone more materials, more tools to support their advocacy around joint integrated programming. So this year we have had additional funding to continue the initiative, and recognizing some of the changes in the global system, but also through a workshop we did in June and a survey that was responded to by about 360 respondents. We recognize that the focus of this initiative, this phase initiative, should be on localization and system strengthening. And so reflecting that, we've developed our online web portal, and we've been trying to reach out to Alliance and INE members who are much more focused on implementation at ground level. The web portal, which Rachel will introduce a little later, the idea of that is that the tools, guidance and resources are much easier to navigate and make it much easier so you can find the specific tools that you need for your programming. So very happy now to hand over to our guest speakers who will give some examples of programming at field level. So firstly, we have Id from IRC. So Lyd, I'm happy to take control, keep control of the presentation. So just let me know when you want me to move these slide forward.
Okay, thank you so much for the opportunity. Again, for those of you who are joining recently, my name is Yirnakacho Fkadu. I work for International Rescue Committee based here in Addis Ababa, Ethiopia. So today I'm going to share some of our child protection interventions that are integrated into our larger education programs in Ethiopia. So what are some of the lessons learned? What are some of the values that we managed to add across these interventions throughout our more than 2 decades of functioning within a protracted humanitarian as well as other emergency and crisis situations in Ethiopia that I'm going to present across 3 important approach. Next slide, please. So one of our first approach that we are using in IRC, specifically in Ethiopia, is IRC's healing classrooms. So what do we mean by when we say healing classrooms? It's a holistic approach that trains teachers to create, a kind of safe, predictable, and inclusive learning environment. So it goes beyond the mere, chalk and talk, and also involve actively, the teachers to get attention of their students and to create that kind of, safe space as well as predictive and inclusive environment, especially in post and in crisis situations where things are unpredictable. So what are those targets that we are targeting across these healing classrooms? We are targeting ECCD and first cycle primary children from the age of 3 to 12, along with their teachers in a crisis or a post-crisis context. Here the targets are not only the students but also the teachers, because they have to equip themselves in order to make sure that they are creating that safe environment for the kids that they are teaching. So what are some of the child protections that we integrate into these target classrooms? This include social emotional safety, usually routines and positive relationships. Teachers are also trained in trauma informed practices and child safeguarding, and we also, as much as possible in IRC, promotes resilience and psychosocial recovery for children affected by crisis through a capacity building of the teachers. So rather than the mere teaching and learning process, such kind of trauma-informed activities and psychosocial activities are involved into the day today teaching routines. What teachers do in the RCC classroom, for your information, the first one is creating a predictable routine and welcoming rituals, which are very active, participatory and active. And they also use calm corners and emotional check-ins rather than relying on corporate punishment, which used to be the case earlier. Now they try to have a kind of, emotional regulation exercises with their students. They also integrate, different, play art and storytelling for healing through their circle time, to make sure that, there is not only, mere teaching and learning, but rather there is also, learning, through play. They also build, kind of trust through positive relationship, identify and refer, protection concerns, and model coping strategies in self-regulation. So it doesn't work only on the students, but as much as possible in our interventions, we try to equip from our practical experience the teachers, because they are also going through trauma, to equip themselves through different indoor and outdoor games, and they do have like that strategy to self-regulate themselves, have some kind of safe space, and teacher learning circles to have that skills. Next slide, please. So these are some of the dimensions. I won't go through it like a lot, for just for your information to see the comparison between before we implemented the pre-healing classrooms and the post-healing classrooms. There are different dimensions that I listed, and the changes that we managed to register throughout the implementation that we managed to do for until close to 3 decades now in here in Ethiopia, across different parts of the country. So you can refer it and read. So I won't focus more on it. Next slide, please. So what are some of the key takeaways that we managed to learn across the years of our implementation across these healing classrooms? Include the first one is teachers are frontline responders. That means teachers play a very pivotal role in children's recovery and resilience. So there has to be so much attention given to them one way or the other in terms of capacity building. And when equipped with trauma informed training, they can one way or the other identify protection concerns early, and they can early refer children into the necessary referral mechanisms. So that makes them very important. The other one is in terms of safe and predictable environmental is very important. Safe and predictable environments are martyrs. So especially when we talk about children, especially in the post and conflict aspects, there are not any safe spaces that they can rely on. So making sure that the environment that they are learning are their safe space. They can truly connect with themselves, and they can really looking forward to learn is something very important. So this goes beyond the day today mere choke and talk. So this different the cell activities, the social emotional, like the indoor and outdoor games, the healing classrooms, the circle times and the play times helps them to along the teaching and learning process, and to see them as a predictable environment for themselves. The other one is the social emotional learning, which boosts of course academic and psychological outcomes. We use different social emotional learnings, which are one way or the other curriculum based, and it has been proved to be vital across different cultures in Ethiopia. So some of them include like brain building, conflict resolution, how they can go along with their peers, how they can regulate their emotions, how to do art, how to explore and exploit the exploration center. They do different activities within the classroom that makes them psychologically cautious and to relieve their distress. So these are the key lessons that we learned. And the other one is teachers' well-being is foundational and very important. To just give you an example, in a post-crisis situation in one of our regions called Amhara region, which was affected by the northern conflict in Ethiopia, if you heard about it. So when we intervene as much as possible, what we are trying to do is to equip the teachers to have some sort of skills so that they can help the students. But after the end of the training, what we found out is that the teachers themselves need some kind of training to self-regulate themselves, and to have some kind of stress relief. So you have to also focus on the very well-being of the teachers themselves, so that they can help their students. So that's also very pivotal and important. The other one is community and caregiver engagement. It's reinforced impact. So you create a kind of a very good environment within the school. So yes, the teachers are trained, yes, but at the end of the day, students will go to home. So we have to make sure that, we have to bring, parents into the situation, into the classroom. So mostly, as much as possible through our, curriculum-based, positive parenting, we try to also, engage the parents so they will have now that kind of skill so that, they will participate, children in the decision-making process, that affect one way or the other, their fit in how to have a kind of skills in terms of positive child rearing practices. The other one is adaptability across context. So as you know, Ethiopia is a multilingual and a multicultural country with different ethnic groups. So we managed to implement this across different parts of the country, in the north in Tigray, in the east in Somali, in the west in Bijares, Benishangul Gumuz. So these are different ethnic groups, but we managed to adapt and allocate it, and we managed to get from our evaluations and from our observation that this healing classroom works for everybody, despite the crisis and post-crisis situation.
You're muted. Sorry.
Sorry, can you hear me now?
Yes.
Sure. Okay. So what are some of the strategic additions over time, specific to the CLE classrooms that we managed to learn, because we have been implementing it for a decade or so now. So the first one is the importance of co-creating classroom is very important. So when we implement it at the first time, we try to use a top-down approach. That means most of the activities and everything was done by the teacher and created by the organization, our organization IRC. But throughout time, we managed to shape and make sure that students also participate in terms of shaping the classroom norms, promoting ownership, accountability, and sense of control, and that helps in terms of like encouraging ownership. And the second one is in terms of positive discipline frameworks. We managed to shift the narrative as well as the practice within the community that corporal punishments are bad, and the teachers and the parents are are now shifting to restorative and relationship based discipline that builds trust and safety, and that's a result of incorporating and well-being and psychosocial supports into the education system. And the other one is the caregiver engagement that I already discussed. There are different curriculum-based activities that we give, including family make a difference. It's a standalone curriculum. We have positive parenting. So parents, through different cycles, manage to get different sessions, and this helps a lot in terms of bringing parents into schools and to have an interest and to ask about, their kids, and to have it as a priority, to concern about their psychosocial well-being, because they are functioning a very pressing environment where economic necessities become first, because they are functioning in a post and conflict areas. The other one is monitoring and referral systems. Now schools are now integrating protection monitoring tools and referral pathways, linking students, other important vulnerable children to health and other important services. Next slide. So one of our second approach that we use across the country in Ethiopia, both in the emergency as well as in a protracted refugee context, is the safe learning and healing classrooms. So it is a kind of structured model where we deliver both learning as well as protection services in emergency, by offering a safe space for learning and psychosocial recovery. So in some of our intervention, our safe spaces has been there for a long period of time, so there is well structured. And in some of our scenarios where conflicts are rise, they are developing, and we might use different temporary materials to develop the space. So as a target, we are targeting about children from the age of 6 to 11 in emergencies. This include displaced refugees, as well as in some cases, since displaced in the host communities as well as refugees live together. We also target children from the host communities. So within this learning environment, we integrate three important child protection elements. The first one is they combine structured learning with, mental health and psychosocial, case management and educational activities are there within the space. We also include, it's very important to include referral pathway and, caregiver engagement, because it's an establishment, and, since, the social workers and other parents that are engaged within the safe space are trained in identifying, child protection concerns, it becomes easier for us, to refer to link it to the larger CP referral pathways, and the caregiver engagement is always there, because we always assign within the safe space trained parents to be part of the larger day-to-day activities within the safe spaces. We also designed for conflict affected and displaced children. So basically these safe spaces are basically function within a conflict or post-conflict situations where learning is impossible or learning is a little bit lagging behind. So children will be available in different foundational skill training, so that when things are settled down and they are back into school, and they will be catching up to the necessary skill sets for the grade that they are in. So some of the key activities here include, the socio-emotional learning that I already, discussed. There are different activities that we give them that are, linked to, brain development, conflict resolution, how they could have a good and productive relationship with their peers, and other important skill sets in terms of art, indoor and outdoor games. So they do such kind of socio-emotional learning activities. They do also, foundational literacy and numeracy activities through the assigned, social workers. There is a structured play and recreation. So we do have like indoor and outdoor games that are, set within the safe space as much as possible. We also encourage, locally producing, teaching and learning materials that are also incorporated for the sake of sustainability. We do also like trauma-informed, group as well as, individual, psychosocial support activities by trained, social workers as well as, counseling officers. We do also, positive parenting to bring parents into the safe space, and at the same time also we do protection monitoring and referrals to make sure that children are safe within the safe space, because it starts from there, right? So these are some of the activities that we do in the SHLS. Next slide. So as previously said, I won't go in detail on this one, but these are some of the dimensions that I identified, as well as, the before and after, intervention in terms of, safe learning space. So you can go through it, and if you have any, questions, you can, put it in the chat so that I will respond. For the sake of time, I will pass to the next slide. Next slide, please. Okay, thank you. So what are some of the listeners, the key takeaways that we managed to learn from this safe spaces? The first one is integration or integrated design drives holistic impact, or mostly can you back up, please? I am on the next slide. Can you show me the previous one, please? Note that one. Next. Yeah, that is the right one. Okay, so good God, it's wobbling. Can you back up to the previous slide? No, you just go front, back to the previous slides. Yeah, exactly, this one. So what are some of the key takeaways from this, safe learning space, intervention or implementation across, decades of experience? The first one is integration is very important. So we do have like ACCD centers, we do have like, separate protection centers or referral pathways, but, SHLS, work best when, it combines this, foundational learning, psychosocial support, as well as, child protection together within the safe space that combines self foundational learning and case management, which ensures of course academic recovery and emotional healing at the same time. So rather than focusing on only the education aspect of academic recovery, here we do have also the emotional healing that we managed to deliver within the same space within the children, which is rare, especially in the conflict and post-conflict, situations. The other one is facilitator capacity is key. So we do have, trained social workers, outreach, social workers, as well as, parents from the community who are trained in, different, trauma-informed approach, safeguarding, cell delivery, and the likes, which are, very important, which helps them in terms of emotionally and professionally important to sustain, quality of care for the children that, they are, serving within the community. And our SHLA centers are, is community owned, so mostly, all the day-to-day activities, the social workers, the parents, all are, from the community. So that's also, one way or the other also elevates, ownership. The other one is community linkage, strengthening, protection as much as possible. So we do try to link it with, different, community-based child protection program that we have. We do have like different, child protection committees and other services, as well as, in some cases, schools, which are also linked to, the SHLS, and as well as, we do have also caregivers who are engaged, through parenting sessions, which reinforces also protection and emotional support, at home. So it goes, beyond, what's going on, and, focus also at home, not only, at school. It also enhances, reach, because now through our outreach workers, we manage to identify, different, children with disability, gender specific needs, diverse backgrounds. So they manage to also leverage, this space. So in a way, the inclusive, design fosters, belonging, and, reduces, marginalization. Next slide, please. So these are some of the strategic additions that we managed to get across, the implementation of SHLS, across the years. The first one is structured SEL and curriculum. As I already told you, we do have like structured curriculums that are focusing on SEL. So we do give them, for selected, students, through, elder students or teachers. Monitoring and referral protocols as within, yes, we use, embedded, child protection screening tools and referral pathways within the SHLS operations. We do have like counselors, we do have protection officers, we do have trained social workers. So this enabled, timely identification and response to, protection risk within the safe space. The other one is, positive parenting integration, which I already, discussed, I said repeatedly. And the other one is, community-based, linkage. Now, child protection committees, parents, parent-teacher associations, and child right clubs within the school can access, the safe space one way or the other, because it's structured, it is there, and it's linked with them. And this positions, the SHLS, as a hub for community engagement and, protection advocacy one way or the other. Next slide, please. So it also helps, the social workers, the different, teachers, as well as, different professionals involved within the SHLS to have a kind of, the support system. They do have, teacher learning circle, a peer, coaching, refresher trainings, emotional support mechanisms, So this helps a lot in terms of improving, facilitator retention, moral, and quality of, delivery, because it's for community by community. That's the approach that we follow. So it helps in terms of sustaining, the intervention when we go out, because mostly we intervene in a emergency context, and we don't, stay for a long period of time there. But the skills are there within the government structures as well as within the community. So I was told the time is up, but I do have one another, approach. So let me.
Yeah.
Okay. Okay. Let me sum it up.
If you can take 1 minute. Yeah. Thanks, Yen.
Yeah. Okay. So the other one is the emergency case fund. Okay. This we managed to, can you take it back, please? Okay, so it's a kind of, rapid response way, a kind of financial response for vulnerable children to address, urgent protection needs and enable, school access. So most of, our interventions are, rigid in a ways that are planned, but what we understand from the feedbacks from the community as well as from different protection structure within the government is there are some important at-risk children, accompanied separated children, dropouts, so those facing barriers in terms of like accessing education because they don't have any scholastic materials, they don't have clothing, anything, or they might need a kind of transportation to health facilities, and this kind of risks are popping up everywhere during our implementation, and we don't have like any mechanism to handle it because it's unpredictable in a way. So we come up with from the learning emergency case fund. So we try to capacitate the Bureau of Women and Children Affairs at the district level, in combination with our social workers. They will do the identification and do such kind of identification and address such kind of popping up at-risk children to make sure that they are staying in school and they are not out of school because of such growing protection and these risks, and this enabled children to safely re-enter into education while addressing their immediate protection concerns through tailored and dignified way of supporting them, because it's tailored and it's specific to a family, and it helps them to address that specific need confidentially one way or the other. So this is coming from the learning that we are that the rigid interventions that we had couldn't respond to some of the protection risks that are arising within the community. So these are some of the learning and approach that we managed to implement within IRC across different parts of the country. So thank you so much. If you have any questions, please let me know and I will respond. Back to you.
Thank you, Yid. I know we asked you to do the impossible, which was to provide a quick overview of very, very rigorous programming in very different contexts. And thank you for highlighting.
Sorry, I was a bit fast.
No, when we share the recording, people can make it longer. You're fine. It was wonderful to hear the examples. And especially wonderful to hear the lessons learned and how IRC Ethiopia continued to adapt the program to meet the actual needs of children as they changed over time. So we have now another presentation from Yagath, who is coming from Child Fund Sri Lanka and is really looking at a process. So Yid focused on programming and sort of real-time adaptation, real-time lessons learned, and applying those learnings. And now Yagath is going to focus on process, which we know in real time is sometimes quick and dirty, but to ensure real sustainability and real ownership through a co-creation process. It takes time, it takes building relationships, and Yagath is going to highlight some of that in his work in Sri Lanka. Yagath, over to you.
Thank you. Hope I am audible enough, Richard.
Yes.
And also you see me.
Yes.
Thank you again. So this is Jagat Kusumsiri, Advisor for Education and Socio-Emotional Learning, Child Fund International, based in Sri Lanka. So I am presenting today on behalf of my Education Director, Janila Nelson, as well as our Socio-Emotional Learning Program Officer, Shushmi Nirmani. So basically, as said, that I am going to discuss about some of the works we have been doing with the Ministry of Education in Sri Lanka, collaborate with them to on social and emotional learning programming specifically. So I'm going to focus on the work we have been doing with the Ministry of Education of co-creation of a socio and emotional learning framework for Sri Lankan primary school children, the process we have followed, as well as the skills we have identified relevant to Sri Lankan children in terms of social and emotional learning. as well as how this socio-emotional learning programming connect as well as impact on children's education, overall well-being, as well as the protection. So next slide, please. Yes, the long-term goal of our program in Sri Lanka to mainstream socio-emotional learning into primary education in Sri Lanka, thereby we expect to enhance children's academic performance, not only the academic performance, psychological well-being, as well as protection. As a country, Sri Lanka, although we are a developing country, we perform good in most of our basic education indicators like literacy and primary and secondary school completion and all the cognitive area. So, but we have a lot of issues and challenges recognized to related to children's well-being and protection. So, therefore, we are here mainly focus on not only the academic performance and psychological well-being and protection, also one of the key expectation in our program. So going into the project objectives, so we have 3 objectives: to collaborate with Ministry of Education to co-create a comprehensive social and emotional learning framework for Sri Lankan children, and develop teacher training package and integrate into pre-service and in-service teacher training, and generate locally driven evidence. So in currently Ministry of Education and Sri Lanka, so they are working on education reform. So this has given more opportunity for us to support Ministry of Education to address some of the issues related to children's well-being as well as protection, and also mainstream socio-emotional learning into education reform works. Next slide, please. Yeah, so just I'm kind of presenting the definition, the CASEL definition, to refresh your knowledge on what is social and emotional learning. So you may have heard a lot, but just this I'm presenting to refresh your understanding. So this is a process which children and adults acquire, effectively apply knowledge, attitudes, and skills necessary to understand and manage emotions, set and achieve positive goals, and feel and show empathy for others, establish and maintain positive relationship, and make responsible decisions. So I am here presenting the CASEL definition, one of the most recognized and globally used definition. So next slide, please. As many of us know, social and emotional learning has become one of the key pillar in education. Education, not like in traditional education, we focus on basic literacy, numeracy, and all the other subject areas. So the socio-emotional learning has also become one of the key pillar in education, which will support the educational attainment as well as overall well-being and development of children and protection. So this is some of the data I am presenting from Sri Lankan context, how this the shortage of socio-emotional learning skills of Sri Lankan children has impact on mental health and violence, and also the risky behaviors of Sri Lankan context. As I mentioned, as a country, we are performing good in basic education indicators, but we have a lot of issues identified related to mental health, violence, as well as risky behaviors of Sri Lankan children. So I am not going to kind of detail out the points I am making here one by one, but still you will find, although we have very kind of small population, student population in Sri Lanka, but still in 2024, we have recorded 200 child suicides, as well as many of our children experience stress and depression, our youth and children, especially related to the issues of educational context. as well as you will see some violence and bullying data related, as well as the risky behaviors. So I think we can share the slides with you. So if you have any questions regarding this, we can discuss it later with the limited time. So I'm going to the next slide, please. So with this all the context, so we have been working with the Ministry of Education on social and emotional learning program in Sri Lanka from 2019, and at a point that we together identify the importance of integrating socio-emotional learning into education. With that, we have started a process to develop a socio-emotional learning framework for primary school children in Sri Lanka. In earlier, mostly the education authorities and some of the other development agencies, they have used many socio-emotional learning framework, but that was not very context specific. That was not addressed the very context specific issues of Sri Lankan children. With that, we have been working with the Ministry of Education to develop this framework, and we have used three-layered research approach, identifying the present layer as well as the future layer and the sustainability layer. In the present layer, we identified the SEL competencies in Sri Lankan national and international program, as well as in the future layer, we focus on identifying the national interest on SEL and education. And in the sustainability layer, we try to identify the mechanism, institutes, and resources for SEL implementation in Sri Lanka. So with that, so we mainly followed three approaches. The first one is a community-based research to gather insight from school communities, including children, parents, teachers, and school directors, and the community leaders on their ideas on socio-emotional learning programming, especially the main required skills for Sri Lankan children, as well as the gaps and challenges in the existing education system on social and emotional learning programming. Also, we have done a desk review and a literature review, analyzing the existing research as well as the policy documents of Sri Lankan education, how the policy documents and curricular documents has been supported to improve the socio-emotional learning skills of children. And also we consulted experts from different which has different perspectives from the corporate sector, development sector, as well as the education experts and mental health experts. So we have consulted. So with that, with this process, we have came up with a social and emotional learning framework, which is relevant for Sri Lankan context, and we have recognized 29 socio-emotional learning skills, and we have identified the implementation guideline and how we are going to assess and role of each of the stakeholders in implementation of social and emotional learning programming in Sri Lanka. Next slide, please. So these are the numbers we have done the consultation. Next slide, please. You will see the map of Sri Lanka. So these are some snapshots from our consultation with school children. Next slide, please. And this is we had several workshops with the education authorities to understand what the existing curricula, how the existing curricula support and the policy documents support socio-emotional learning skills of children, and identify the gaps and challenges, as well as to identify the very critical important skills for Sri Lankan children. Next slide, please. And also we had consultations with experts, including mental health experts, education experts, and counseling workers and child protection officials in Sri Lanka, child protection officials and experts in Sri Lanka, and develop with the development partners, including UNICEF, Save the Children, Road to Read, British Council, and World Vision Life for Sri Lanka, who are working in Sri Lanka to support children's education and socio-emotional learning skill development. Also, we consulted corporate leaders as well, because they are also kind of facing some challenges who are coming newly for the jobs with some of the issues related to the social and emotional learning skills. Next slide, please. So this is from our one of the workshop we had to develop the framework with the key elements from the different inputs from the community research and the input from the education officials, experts, and partners and corporate leaders, and the desk review findings, curricular review findings, and the consideration of the international and local framework. So we use all these inputs to come up with the framework, and finally we recognize 29 skills, socio-emotional learning skills. Next slide, please. So this is the framework. So we have recognized mainly skills related to social, emotional, values, cognitive, and identity domain. So I will be briefly presenting the skills from each of the domain. Next slide, please. So you will see, I'm not going to read one by one. In the social domain, so we have recognized 5 skills: collaboration, cooperation, leadership, responsible decision making, communication, conflict resolution. Emotional, also we have identified 4 skills. And in the cognitive domain, we have recognized, prioritized 4 skills. Next slide, please. And in the values domain, there are 6 skills, as well as in the identity, we have recognized 3 skills. So basically, I want to share that this framework we developed based on the INE and the Harvard University analysis of these 6 domains: socio-emotional, cognitive, values, identity, and perspectives. The skills we identified as perspectives, that kind of we have combined in the other domains. Therefore, we have come up with 5 domains. In addition to that, next slide, please. Specifically from the Sri Lankan context, with the consultations of children as well as many stakeholders, education experts, we have recognized 2 other domains related to children's well-being, safety, as well as their development, the safety domain and the digital citizenship domain. So in that 2 domains also, we have recognized under the safety 3 skills: respect for rules and safety, and this as the second skill, self-protection and preparedness; third, emergency awareness and safety. In the digital citizenship domain, digital literacy, again, digital safety and responsibility, digital well-being, and digital creativity. So in the initial stage of the designing of the research as well as the framework development process, we have not recognized these types of skills, but with the consultation, so they have recognized, especially the children, they have come up with many concerns they have related to their own safety. So we have recognized these skills, especially from their point of view, as well as with the discussion, with the consultations with the education experts and other development partners, the digital citizenship skills was also recognized, which has direct connection to the children's socio-emotional learning as well as their well-being, protection, and education. So these are the skills we have recognized in our framework. Next slide, please. So in addition to that, we have recognized the requirements for effective SEL implementation in schools. Next slide, please. And the role of homes and communities in supporting SEL. So all these information have been included in the framework document, co-created framework document, the Child Fund and the Ministry of Education developed. And now we have almost completed the work of development of the socio-emotional learning framework, and we are working with the Ministry of Education to integrate the socio-emotional learning framework, these skills into the upcoming curricula, teacher training, as well as both including pre and in-service teacher training. So this is all from my end. Thank you for listening to me, and also would like to answer any of your questions if I am able. So I want to remind the support I have been given my education director, Janila Nelson, as well as Shuishmi Nirvani. Thank you very much for the opportunity given. Thanks.
Thank you so much, Jagath. And yeah, there are some questions in the Q&A. Yed, thank you for answering the ones about your presentation. And then we will also have an open Q&A at the end of the session where we can have some discussion. But there's a question there for you at the moment in the Q&A, Jagath. You can have a look at that while Rachel continues with her presentation shortly. Just very quickly, the whole presentation and the recording from today will be shared after the webinar as well. So all the documents will be there, including the links. So Rachel, over to you. Then let me know when ready to share the screen and I'll stop.
Sounds good. And thanks again to both Yid and Jagath. I know it's impossible to put everything into a 15 or 20-minute presentation, but I am hopeful that all of us sort of come away with an understanding of adaptation in real time, but also for Jagath's presentation, you know, the effort needed to really ensure that some of the work that we do is jointly owned, not only between the two sectors, education and child protection, but also across multiple stakeholders, and most importantly, perhaps, local communities and national authorities who should be driving, of course, what we are responding to. So I am going to, and thank you everyone for sticking with us. I know that webinars tend to only be 1 hour, and this is a longer webinar, but the next 30 minutes or so, we're going to get into the web portal and explore, and then you'll have an opportunity to explore in real time as well. But just first, I wanted to answer some of the questions that we've seen come up in the chat box, but also that we know will exist in your minds right now. First, where can we find the web portal? You know that, of course, as Mark elaborated around the joint initiative, it is INEE and the Alliance both contributing to and driving this initiative. And the web portal is hosted on the Alliance website. We are going to ensure that there is a link on the INEE website, but currently it is hosted on the Alliance website. We will share the link in just a minute. But the idea, of course, is to ensure that the work is reflected on both websites, so that if you do tend to go to inee.org first as an education practitioner, you will be able to, or you will be pointed to that web portal. And likewise, if you're approaching it from the Alliance, you'll find everything there, hopefully easily to find and navigate. What's on the web portal? The web portal includes not only resources that we have created between the two networks, between Alliance and INEE, and have co-branded and sort of co-own, but also perhaps more importantly, you'll find a lot of resources that have been created by your organization or by your peer organizations, with the understanding that, you know, the resources that INEE and the Alliance create is, of course, developed through co-creation processes that draw on member experiences and go through a pretty rigorous review process and feed-in process. But it also relies on the organizations and communities of practice who feed into and then elaborate in their own space, in their own organization, in their own context, on some of the more nuanced approaches and nuanced issues that we simply can't include in global goods. So you'll find everything from sort of a macro level, the child protection and INEE minimum standards, the guidance note that looks specifically at the integration between the two sectors, as Mark described, and I'll show in just a minute. And then we have hundreds of other resources that have been created by members. How do you use the web portal? I'm going to show you. But first, I'm going to show you a slide of what the web portal looks like and how we've organized the content. Mark, can you go to the, thank you. So this is what when you actually access the web portal, this is the first thing that you're going to see. As I mentioned, it's hosted by the Alliance. You'll see at the top right-hand corner, it's the current web page, or the portal is in English, but as Mark mentioned earlier, we're hoping to very quickly populate the Spanish, French, Arabic, and Portuguese languages, because we do have, you know, through all of the resources made available through the networks, we have a number of resources, of course, in each of these languages that we want to make sure people are accessing, and also adding to. This is not a stagnant web portal. We are very hopeful that at the end of this webinar, you're going to think of some of the work that you use, some of the resources that you've either created or that you use regularly that need to be on here, and you'll send them to us so that we can add to this resource. Mark, next slide, please. So we've organized the actual resources around the child protection and education and humanitarian action guidance note. So you'll see that if we've attempted to make it easier for you to find the resources that are particularly important to your work. And we know that many of the responses, many of the issues that you're working through, of course, cut across several of these areas. But we needed a way to organize the content. So we have organized it around capacity strengthening, foundational areas of work, enabling interventions and approaches, safe access and protective learning environments, well-being support for caregivers, education and protection personnel, and then elaborated on some of the risks that, or the children who are at risk of having their protections violated or taken away. Elaborated in some of these areas. This is not an exhausted list. We know that there are other vulnerabilities, other risks, and we'd be happy to add to that as well. In addition to the more programmatic resources, of course, if you'll remember the previous slide, we also have policy and advocacy documents. We've got, sort of core documents for implementation. So what I would like to do now is to take you through. Mark, can you allow me to share? And I'm going to, hopefully very quickly, pull up the webpage. Apologies that this is, oh dear. Okay, let me, sorry, we're gonna get there. Yeah. Sorry, I'm gonna need to. All right, are you able to see the Alliance web page, the web portal? Can someone give me a thumbs up? It says that my screen sharing is
It's
paused.
screen sharing, but it's just black at the moment.
Okay, let me try this again. Apologies. All right, are you able to see the Alliance web portal now?
Yes.
Great. So I'm going to quickly take you through what this looks like when you actually enter the web portal. And in just a minute, we're going to share with you the link and ask you to play around with it yourself, or not only by yourself, but also together while we're together on the webinar. So as mentioned, we have up here, there's some shortcut buttons. If you want key resources, it takes you to the thematic resources that I just walked you through, that has the graph and looks at foundational areas of work, etc. We have training and development that takes you to relevant training for both networks, as well as some of our partners like the GEC and Kaya. The implementation guidance looks at both networks, child protection and INEE minimum standards, as well as the guidance note that really is the backbone of all of this work. So the guidance note, and I'm going to take you into it in just a moment, the guidance note really gets into those areas of work and provides some additional signaling of appropriate approaches and ways to navigate some of the challenges that we together as child protection and education practitioners need to address. We have advocacy documents, we have reports and evidence that not only are great resources for advocacy, but also allow us to see lessons learned across multiple contexts that would help us, not only understand how others have addressed a particular challenge, but also, influence the way that we're responding and continue to adapt to an evolving understanding of need and response. And then, of course, we have the minimum standards here as shortcuts for both sectors. And I know that looking at the introductions of everyone, it looks like there's a number of people who do already have very strong intersectionality between the two sectors, but it's always worth digging into each sector separately, as well as looking at the points of intersection, those touch points where we meet and should be collaborating. So very briefly, and apologies, I know this might be a little boring, but I think it's important to sort of orient you to the information that's presented on the web portal. So we have some of the impacts and the reasons behind integration here. Mark went through many of them at the beginning of this webinar, but this is a short sort of recap of that. And obviously, provides a very quick snippet if anyone asks you why we're trying to collaborate, why spend the effort on collaboration. It's a quick reference for all of us. Supporting change, just a reminder that we're all in this together. We're all contributing in different ways, but we do need some core guidance that allows us to sort of have a starting point. And I know that many of you are beyond a starting point, but it's always good to refer back and continuing to build, regardless of where you are, if you're 5 years into a program or just starting a program, or policy development or advocacy, whatever your role and responsibilities are. We don't want this web portal to take the place of the guidance note that has been co-created with many, many members of both the Alliance and INEE. We want you to be looking at, or referencing both as needed. The guidance note, which is linked here, has, in addition, not in addition to, but has for each of these areas of work. So for example, meaningful child participation, it has an overview of why child participation is so integral to an appropriate response. It has guiding questions that are meant to drive conversations between the two sectors to understand how and when and the best way to respond. It helps identify gaps in responses and policies and practice. And it looks also, it's organized around the socioecological model. So it tries to pinpoint your entry point. So if you're a national authority working with policy development or curriculum, it looks to ask the questions that help you get at the answers that you need at that policy level. And then you have community, you've got the school community, family, and child. So they're questions that allow you to sort of dig into not only sort of macro level response, but really what does this look like across all of the layers of programming. It also includes sample list of indicators. I know we all struggle with this at different times and for different reasons, but it does give example indicators of some things that could be monitored either together across many partners or within your own organization, a starting point for measuring impact, for measuring process and impact. And then additional resources, and those resources are all listed in this area. And then some examples similar to the ones that Yid and Yagath shared from Ethiopia and Sri Lanka. I'm just going to open, I know we're sort of in, short on time, but I do want to make sure that you are aware of how to find the guidance notes. So this is if you see this picture, you're in the right place. But very quickly, and apologies, I know we're well into the second hour, but the guidance note is organized in this way. It's the exact same organization as the resources on the web portal. I'm going to jump into meaningful child participation so that you see what I just sort of talked through. It has a very brief overview of what the issues are, challenges are. It provides you at the socioecological level questions that you can be asking together. And indicators, the indicators come from a number of different indicator frameworks, including, of course, the Alliance and INEE indicator frameworks, but also draws on GADRS, draws on ISC, it draws on a number of different type of indicator frameworks. All of those are included and referenced across the entire guidance note. So then you'll also see all of the resources. These are the resources that you're going to find on the web portal. Some of them are, the entire resource is appropriate, and some you may only want to look at a couple of sections. So I'm going to stop sharing that and go back to the page itself. So for example, we were just on the child participation, meaningful child participation. So you're wondering, how do we do this? How do we do this in the most effective way at the beginning of a response? How, we know that we need to hear children's voices. How do I do it ethically? How do I do it safely for everyone involved? How do I support others to do this? So I click on meaningful child participation. And this is what you're going to see. You're going to see some of the same text in the foundational areas of work, but then you're going to come down and you'll find resources that we've already pulled from our collective libraries and highlighted here. So for example, we have one from Save the Children in multiple languages. Some of these, and again, we know that language can sometimes be a tricky element to our work. We want to ensure that we're working in the language of instruction, the language of industry, but we know that many resources are not always available in all languages. Where we can, we have posted the languages that they are available in, and we'll have you'll have the ability to search by language as well. So you can see all of these are, you would go through all of these and find the one that is most helpful for you. And we've really tried to ensure that where possible, we have resources that look at more of the policy advocacy piece as well as the program implementation. I'm going to, well, wait, let me just make sure that you also see some of the, like how the rest of the web portal is organized. Key resources are included. It's helpful to have everything on one page. You can just scroll down. You can see key resources for policy advocacy, training and development that I mentioned before. And then at the very bottom, below the reports and evidence, you will find the person and the contact that you can send additional resources to, or if you have questions on how to use resources, or you're not finding what you need, you can contact Mark Chappell. He's the person who started the webinar and will lead us through the Q&A in just a moment. But we are very happy to receive any question and any resource that you think might be wonderful additions to the starting point that we have now. I'm going to stop sharing, Mark, and you can pick up again. And I apologize. I know we've lost people, not only because of time, but it's not easy to sit through an hour and a half of this work. So thank you for sticking with us. Now I think we are ready to move to the next slide, Mark, where we provide the, and thank you for putting the link in. So we have now the link of the web portal on. It's the Alliance CPHA. I encourage all of you to jump in if you can. Open it up, make sure that you can open it. Let us know if you can't, if you're having issues for any reason. We thought to, because we're a smaller group, we thought that we would ask all of you in the chat box to maybe think of 1 or 2 areas that you're working on now in your program or in your office, and you know, trying to navigate whatever it is. It could be one of the questions that's already been posed to one of the panelists. It could be a new question. We've seen, I think, issues around you know, sexual abuse in schools in the chat box. We've seen questions on MHPSS and collaborating with national authorities to really drive a process to support all teachers. But we'd like for you to put into the chat an issue, and we would take a minute to find relevant resources together on the web portal. And if you want to just jump in and start to look by yourself, that's totally fine, but we welcome the opportunity to do this together. Does anyone have an issue that they're struggling with, or that they think they need additional guidance in? Corporal punishment across schools. Great. Okay. So Mark, actually, do you want to pull up the website or the web portal and walk through, or do you want to hand the share back to me? I didn't think about that.
As you like. If you have it open, Rachel, go for it, or I can do it.
Yeah. Okay. So for the benefit of all of us, what is CSAM? Iggy Nadiri, could you elaborate on the acronym, please? Thank you. Thanks. Mark, you can share.
Rachel, you froze then, sorry.
Oh, did I? No, I think I. Do you want to go ahead and pull it up, since you're your host?
Okay, 1 second.
Yeah, I see a lot of questions on the case management, and I think it also speaks to the referral mechanisms as well, and making sure that the systems are really closely linked, not only so that within the education program, whether it's formal or non-formal, you know, that there are structures in place to ensure children are protected, safe, but also that the teachers and other education personnel know when and how to ensure that the children are receiving that additional support beyond what a school can and should be responding to. I mean, I think we all know that, you know, teachers can only do so much, and it's and that we need to be ensuring that services are available across the socioecological layers, right? Well into the family, well into direct service case management responses. So
picking up on some of the questions.
Yep.
Sections in the chat. Yeah, case management, when we talked at the start about specializations that sit within their own sectors. So case management is very much child protection activity, but referrals into case management would take place within education or with education actors or through joint programming. And you know, it was great. We had some questions there for Jagat as well. It was great to see how that happens in Sri Lanka. And also Yid gave some examples of how that happens through the Healing Classrooms work in Ethiopia too. So some real solid examples there. I see a number of questions here which are talking about sexual abuse, SGBV, and sexual harassment. There's a point there in child protection principles. Now that would be slightly separate. We do link to the child protection minimum standards at the top of the web page. Rachel said we have the INE minimum standards and the child protection minimum standards, and that would give the basic principles about child protection. But in terms of the GBV related issues, you'll see in safe and protected learning environments, as well as MHPSS and SEL, we have school-related gender-based violence section. But then also we have children who are at risk of their protection rights being violated. So within here, there's a gender section, and there's also a section on harmful cultural practices, which might also talk to corporal punishment and gender-based violence as well. So, for example, if you click on the school-related gender-based violence here, you go into the section on safe access and protected learning environments. And as Rachel said, the filter will automatically take you to related resources around that. So we have, these are just some examples: education response to homophobic bullying, multiple languages, disability, safeguarding, prevention of sexual violence in education settings, school-related gender-based violence, school-related gender-based violence, a whole school approach. So as you can see, there's a lot of reports, resources, and tools in here to help you in your planning and implementation to address your concerns around SGBV. So that's just one example. And going back to the main page here, as I said, we might have some concerns about harmful cultural practices under the children who are at risk of their protection rights being violated. So again, we go through to the main language page for that overall section, and it's filtered here by harmful cultural practices. So there's an example here around how to prevent and respond to child early and forced marriage, early marriage again, how to engage with traditional leaders around child marriage, and a section here on physical violence and other harmful practices. So when we talk about your questions around corporal punishment, there is some resource here in the video series. So this is an example of how you can use the toolkit to address some of your concerns. So as Rachel said, it'd be great to hear from you. You know, you've got the link now. Have you been able to find related resources for your area? You can put it in your chat, or feel free. We can open up now the Q&A for a conversation.
I will jump in very quickly. There is a question in the Q&A. I guess you can use it as an example to go through the portal one more time. What do you think?
Yeah, thank you, Maria. Yeah, so there's a question here around children with special needs, working with visually impaired and hearing impaired children. Mitigation levels, what mitigation measures can we use? As we flagged, there's a specific section here under children who are at risk of their protection rights being violated on children with disabilities. So if we click into here, you'll see a whole section on inclusive education from the INEE website, training in 4 main INEE languages here. So this is a really good example of where you can build capacity with you and your teams on how to address disability, inclusive education. Another INEE publication on the foundational principles. Inclusive education as distance education. Save the Children's Inclusive Education Resources. how to use information communication technology. So as you see, there's quite a lot here that you could use to support your planning. So hopefully, Asadiru, this will be very helpful for you.
We also have the section on combating discrimination and ensuring inclusivity under enabling interventions. It has less on specifically supporting disabilities, but it does provide an overarching sort of set of resources on inclusion and equity in education and approaches that you can take, sort of lessons learned in addition that you could look at together with the specific resources on disability.
And then I see, Mohammed, you've noted, and getting it noted about safeguarding. So there's a section in the enabling interventions here on child safeguarding, including feedback and reporting mechanisms, which also links to the questions around case management. So there's some examples here of safeguarding child protection policies, and then a comprehensive guide on how to embed child safeguarding in education coordination functions. So this comes from the cluster, so it's coordination focused, but we'll have learning for implementation. Save the Children Safeguarding Emergencies Toolkit, and something which spans the previous questions around disability. So how to have disability inclusive child safeguarding. Linked to safeguarding is opportunity for children to be able to feed back any of their concerns. Excellent guide from Plan here on how to set up and use child-friendly feedback mechanisms. And then UNHCR's overall operational guidance on accountability to affected people. So again, examples here on safeguarding. Now, one of the important things that Rachel flagged at the start is one of the reasons we wanted to move this from being a sort of paper or PDF guidelines is that we wanted to be able to update this. So if there are resources that you feel we've missed, please email me or email Rachel or email INE or the Alliance and let us know if you have some really good examples of tools or resources which would be helpful for other practitioners as well. So we very much welcome this. So there's a new question coming in the Q&A. Okay. So very technical child protection question on managing cases with both CP and GBV elements. So the case management elements aren't really captured so strongly on this portal because this focuses on the overlap between the technical specialisms would be more likely be in the child protection minimum standards. So we've already flagged some of the resources here on school-related gender-based violence, which would link to that because it's taking place in the school. So it would refer to child protection and cases of GBV against children. Similarly, in the gender section here, in the harmful cultural practices. But the more specific elements around case management would be in the child protection minimum standards. So I can see the chat and the Q&A. Any other questions or suggestions? Hopefully people are able to use the website and are able to find the things they need.
And of course, I know several people have had to leave already, and Judy, thank you for letting us know that you need to drop off. We completely understand. This is a longer section, but very happy to have the time to talk through and actually walk through the web portal so that when you're using it on your own, you can more easily find the information that you need. Happy to see that people have found it helpful. And I just want to thank Yid and Yagath for coming in and sharing their examples of from their own contexts and processes and programs. I think it's always helpful to start with the realities of the issues that we face in different contexts and how we're responding to them, and how then you can use this resource, the web portal, to support you wherever you are. Again, this is not only for acute emergency response. It really looks at you know, the resources and the processes that you would want to take and bear in mind across all stages of an emergency, from anticipatory action, preparedness, through the actual response and recovery.
If there are no more questions or comments, very happy to give people 20 minutes back for their day. And as Rachel said, huge thanks to Yagath and Yid for all your work in Sri Lanka and in Ethiopia, and for sharing your programs and updates. Very, very helpful to see how in Sri Lanka you've been able to affect the policy there around SEL, and how the healing classrooms has really been a boon for some of the children in some really challenging situations in Ethiopia as well. So thank you for your support there, and I'll also be in touch and follow up. We will send a recording of this and the presentation afterwards. Feel free to share that. And of course, I put my email in the chat there. Please do get in touch with us if there's anything that you want to add to the website, or any challenges, broken links. Also like to give huge appreciation to our colleague Kira at the Alliance, who did most of the hard work in building this website for us. A huge piece of work in terms of uploading all those resources. So yeah, just like to acknowledge that. She's doing a brilliant job. So yeah, thank you. Thanks for your time. We will also be sending out a notification of when we're running these sessions in the other INE languages, hopefully within the next 3 or 4 months. Thank you all.
Just Mark, before we end, sorry, there was a question on sharing additional examples from country programs and learning from each other, and just a reminder that there will be additional language orientations and opportunities through INE meetups and the Alliance clinics to continue to share your work in different ways. And so you should see, hopefully very soon, within the next couple of months, invitations to the INEE and Alliance memberships to attend and participate in Arabic, Spanish, French, and Portuguese sessions similar to this. And that's one time when you could certainly offer to be, to share your work as an example. Okay, back to you, Mark. Sorry, you were saying goodbye.
No, just thanks everyone. Yeah, thanks to colleagues at INEE and Alliance for supporting this, and we will be in touch soon. Enjoy the rest of your days.
Take care, everybody.
Bye-bye.
Good work.
Thank you. Bye-bye.
Thank you for sharing.
Have a good day. Bye.